mother, in the Department of Emergency Medicine at UT Southwestern, and I'm on the admissions committee of the medical school at UT Southwestern. I wanted to talk to you. I realize this is a very short session, and I wanted to just chat with you just a little bit about if you are actually really seriously thinking about medical school or about nursing or about PA school, that I wanted to give you an idea of what you're getting into. And I'm going to number one, encourage you, but number two, caution you, because it's a long, long road. Medicine is a wonderful career. I got into medicine almost a half century ago, back in the early 1970s, in my home in Georgia, west of Atlanta, where I'm from. And I actually went home and practiced medicine in my hometown, emergency medicine and urgent care, for 20 years in my hometown. And then I retired in my late 40s, and I was offered a job here in Dallas at UT Southwestern, and I just said, I think I want to do that. So I changed. I moved. I became a Texan. I started eating barbecue, and I really found out that I really love it here, and I love the university. It's a great place. I work at Parkland Hospital. Parkland, you may know about, is the busiest emergency department in the United States. So good old downtown Dallas has the busiest emergency hospital in the country, and I just worked all weekend. I'll be working tomorrow. I work full-time in the ER, and I have a lot of observations, especially about this COVID epidemic, which are, let me just cover the COVID thing for a moment. For goodness sakes, wear a mask when you go out. Please, for goodness sakes, wear a mask. I can show you, absolutely, Jasmine. This thing is increasing. The patients in the hospital are increasing. This is a miserable illness to get. And if you get it and you're what's called an asymptomatic carrier, meaning you're infected but you don't have any symptoms, you can give it to your mother or your grandparents and it may kill them. You don't want to do that. I mean, for goodness sake, you want to use good sense. So please be careful. This infection is not going away. Your study word for the day, get your pencils or your pens. I want you to write down a word for your study word for the day. Are you ready? And Jasmine, put it in the chat, please. The word is endemic, Endemic. Put that in the chat for them. Your assignment for the evening will be to look that up. What does that mean? And what I'm going to tell you is that this epidemic, which is now covering the entire world, this COVID epidemic, this thing may not go away. And there's a history for that. Back in the 1980s, when I was back in Georgia working as a young physician, HIV showed up, and we did not know what this thing was. And for a number of years, we thought HIV might kill everybody in the world. We did, because there were no treatments. What happened over the 6-7 years was that treatments became available, initially AZT, and then the other antivirals, and then the protease inhibitors, and ultimately HIV became a drug that, if one catches it, you don't want to, but were one to, that you can pretty much live a normal life with it. And the cause of death for someone would be a car wreck or a trauma or a heart attack or something like that. This coronavirus, COVID, we just don't know what's going to happen. So I just urge you to have caution and use good sense. Wash your hands, wear your mask. If you can't find a mask, let Jasmine know. I will find you a mask, or 2 or 3. I will. Because this is very, very important, and the patient numbers are only increasing right now. Now, back to the subject at hand, since we've only got about 10 more minutes for me to talk to you. I wanted to talk to you a little bit about the path of becoming a physician, and to do that, I'm going to share my screen. Hopefully you can all see it. We have formed a group called Virtual Shadowing. The website is virtualshadowing.com. And you are more than welcome to go out there. Let me show it to you. It's virtualshadowing.com. And 7 pre-med students and I, and also 1 pre-PA student and the group, have gotten together to put together these sessions. For example, June 16th we just had was the introduction to physician-patient interaction. Tonight we'll be talking about a specialty on emergency medicine. You are more than welcome to come in. It's about an hour. It'll be Zoom, and one of our wonderful emergency physicians will be talking about her life as a young emergency doc in an academic environment, also how to be a mother and a wife while working a full-time busy job in an emergency department. So you're welcome to come. And if you'll go to virtualshadowing.com, you'll be able to find the link. This is all of us, and these are all a bunch of pre-med kids. This is a pre-PA kid. And and kid is a compliment, by the way. And we come together and we put these sessions together once a week. What I wanted to show you is that I'm going to show you 2 slides and then I'm going to stop for questions. If medicine is what you want to do, then you have to think about one very important thing, folks. Medicine is a business of being up close to people. And I don't just mean from an infectious disease standpoint, I mean like COVID. But it's a job, it's a profession, it's a career where you become close to people. Indeed, you have to be cautious about getting too close. Old Aunt Minnie, who has cancer and is dying, for example, if you get too close, it can be too personal. And if you'll go to my website, rayfowler.com, and you can put that in chat, rayfowler.com, and go out to my book out there. This is all free. Go read a couple of stories. Read the story called Amazing Grace. These were all true stories. They happened just like it happened. And this was a story where I had a cardiac arrest patient, a woman who was dying of cancer, and we took care of in the ER. And it was a very, very moving scene. And it's okay. Number one, you only want to go into medicine and or nursing is it if you want to become close to people. You have to let yourself do that, because in becoming close to people, you become a better servant. This is one of the ultimate service businesses, namely taking care of people who are ill. Because especially in my world of emergency medicine, people who come see me, they are terrified. They are worried, they have a horrible pain, they've been in an accident, they're having a heart attack, they have cancer, they have something awful going on. And they are scared nearly to death. And so I can have the opportunity to go in there and say, my name is Dr. Fowler, and I am your doctor, and I'm going to take care of you. I'm going to get you some medicine and make you feel better, and we're going to figure this out, and we're going to take care of it. Now, if you need anything, here's my card, and I'm right around the corner, but I am going to take good care of you, and we're going to figure this out. Well, if you think about it for a minute, isn't that what you would want to hear if you were sick and sitting in an emergency room somewhere hurting like the dickens, broke your leg, you're scared half to death? If somebody comes in and says, you can lean on me. Well, that's the reason to get into this. You could be a doctor. There are 2 types of doctors, MD and DO. MD is medical doctor, DO is doctor of osteopathy. You see that on the slide in front of you, I think. You could also be a physician assistant. You could also be a nursing practitioner, or you could also be a nurse, or any of a group of technical jobs, such as working in a laboratory as a medical technician or a medical assistant, and so forth. These are all wonderful jobs. But to do it, the reason to do it is because you want to be close to people to help them through a difficult time. I know that sounds corny. I know it makes me sound like your grandpa and your grandma, but I will tell you, after nearly a half century in medicine, the reason I keep coming back, and I will be in the ER tomorrow afternoon, is because it's the best thing that I do. It is the best thing that I'm a single guy with no kids. And so the best thing that I do in my life is that I go and I'm a doctor. And I really like it. It is so hard. You have to study all the time. Speaking of which, let me show you the next slide. Now I'm going to project the slide, Jasmine, so that they can see it a little bit bigger. We're going to stop in 5 minutes, okay? Now, if you really think that you may want to go to medical school, here is an example of what it takes to go to medical school. Y'all are in high school right now. You have to make great grades in high school so that you can get in the college of your choice or one of the colleges of your choice. Folks, you have to make great grades in college. If you think I'm kidding, you won't get in medical school. The competition to get in medical school and PA school, and nursing practitioner school The competition is tough. These are straight A kids. On the admissions committee of UT Southwestern, we receive 5,000 applicants a year for 230 spots. If you apply to our school, UT Southwestern, you have a 4% chance of getting in our school. It's very competitive. You got to buckle down and you can't lighten up. Look here, focus right here. If you think you want to go to medical school, focus right here. Straight A's. Straight A's. That's what it's going to take. There are two things that it takes for someone to have a medical career, really any career, but for a medical career, there are two things. You have to have some smarts. That word is called aptitude. You've got to have some smarts. And you've got to have the willingness to work. That term is called work ethic, and it takes both. And if you think I'm kidding, you're wrong. It may be that you, and I hope you have. I made pretty good grades in high school. I knew how to work, but I made pretty good grades. I was reasonably smart. And it may be that things come pretty easy to you. Well, I will tell you, folks, that by the time you get into college here, you're going to be surrounded by people who are in the competition to go to school, to go on to college, to go on to medical school, to go on to PA school, to go on to nursing school. During the time here, you'll be taking your prerequisites. For example, we look at organic chemistry, the score that somebody makes in their organic chemistry course, to predict how well they'll do in medical school. Medical school is hard. I'm not dissuading you or trying to convince you not to do it. I'm just telling you, it's a long road. And then you get into junior year, where at some point you'll take the medical college aptitude test and begin your applications process. You may or may not take a year or two off after college. I encourage people to think about that, but you've got to have stuff you're doing. Don't just take a year off and sit by the beach and do absolutely nothing. A gap year, we call that, after college, is reasonable, but you would want to do that if you have a project that you want to do, like learn Spanish, like doing research. For example, I just hired a full-time gal who's working with me now, who just made 4.0 average at UNT and is now doing a gap year with me doing research. Then you go to medical school if you can get in. And you have what's called the preclinical years before you end up on the wards. And then you end up on the wards, and then you end up ultimately in the senior year. At some time beginning in your third year, you then have to apply for a residency. You don't just finish medical school and then go see patients. You have to then go do a residency of between 3 and 7 years. 3 typically is emergency medicine or family medicine. 7 years could be plastic surgery or somewhere in between. So look at this. The high school you're in now, 4 years of college, during which time you've got to burn it up on your grades. And then 4 years of medical school, followed by 3 years or more of a residency program. And by the way, back here at medical school, you have to burn it up in medical school so that you can get into a residency, such as emergency medicine. In our residency program, I'm on the interview team that picks our residents. We last year got 1,700 applicants for 22 spots. If you apply to our residency program, you have a 1.5% chance of getting in. It's very competitive. You can do it, but it takes the aptitude. You got to have some smarts and the willingness to work. Following your residency, you can go do more individual study in other things, such as plastic surgery. We have a fellowship in emergency medical services, or toxicology, or simulation medicine, and so forth. And so this is where I just wanted to give you an idea. You can do it, but you got to have enough smarts, and I'm sure you do, otherwise you would not be on this program today. But you've got to have the willingness to work. Jasmine, if you ask Reagan, who is the gal taking the gap year, who's working with me, when she came to see me in her first year in college at UNT, her father was working with me, whom you may know, Dr. Rosenberger. And she came in and we talked, we had lunch, and I said, you can do it, but there's just one requirement: straight A's. And she did it. She made straight A's at UNT, but that's the old fashioned way, which is hard work. A physician assistant has a similar but less long timeline, high school, then college. Then you have the first 2 or 3 years in physician assistant school, following which you can do a residency after that. Well, Jasmine, I'll stop sharing now. I know it's already gone long. I don't want to scare y'all out of it. I want you to be practical. Now, let me give you a little bit of grandfather advice. It's very interesting that on the applications that we read, you'll see an applicant for someone who's had a driving under the influence of alcohol citation where they got busted for a DUI. Folks, I can tell you, if you get a DUI, you will probably not get into a professional school. Don't you dare have alcohol on your breath and get behind a car, period, ever. Don't you do it for a couple of reasons. Number one, it's illegal. Number two is you may hurt somebody. And number three is that if you get caught, you may work your tail off to get into a professional school and you won't get in. And if you think I'm kidding, just come on up to the medical school and I'll show you some people who've had great grades. The problem is that we want people to come to medical school who are going to be in medicine and be doctors for Texas for a long, long time. I've been seeing patients now for 43 years. We want doctors like that who will come and work a long career taking care of people, as opposed to getting into trouble or becoming an alcoholic or becoming depressed or suicidal, becoming cynical and burnout. And so many of these things, Jasmine, that we see in all careers, but also in medicine as well. I don't mean to scare you. I just want you to be practical. I want every one of you to go to medical school or DO school or PA school or nursing school or nursing practitioner school. I would love to try to help. One of the things that we do, Jasmine, is that we set up shadowing experiences. And Reagan, one of the reasons she came on was to help coordinate shadowing experiences. If you're going to think about med school, PA school, nursing school, getting some shadowing time is a good idea. You can also go to our website, because what's happening because of the COVID outbreak is that there are most places, most ERs, like my ER, for example, are not letting kids in right now to shadow because of the COVID outbreak. It's for several reasons. Number one, we don't want you to get infected. Number two, that mask that you would wear, we need that mask because we're kind of short on masks right now. Well, that was a lot. I hope I don't scare any of you off. Dar, what was that word I asked you to look up? I can't hear you. I can read your lips though. Endemic, right? Look it up. I'll go ahead and tell you, endemic is something we saw happen in the 80s with HIV, namely that the disease came, but it never went away. It came, but it never went away. It stayed. HIV is in the population, as is hepatitis B, hepatitis C, and so forth. If you go to Africa, as an example, malaria is endemic in Africa. And so I'm afraid that COVID may be becoming endemic. It may not go away. And if you were thinking about getting into medicine, there is the chance and the fear that you may get infected yourself. It's true. You might. That's why we want to use good sense, wash your hands, wear your mask. The term is personal protective equipment, as you know, PPE, to do what you're supposed to do and use good sense so that you can take care of yourself, so that you can also not transmit the infection to your family and so forth. I swore, Jasmine, I was going to shut up and take a question. So any chat questions, or what do you got there?
Yeah, you guys, it's a little bit past 12:15, but if you want to go to another with me, you can. I'm recording this and I'm not recording it. I'm putting it on the live stream though, and I'll send it out later. But if you guys want to ask questions, you can stay longer, Dr. Fowler, if that's okay. But if you want to go to another with me, you might want to hop off and do that now. Does anyone want to get started with questions?
So Dar, what are you going to be when you grow up? I'm picking on you because yours is the first picture I see here. What are you going to be? Come off mute. There you are.
I wanted to be a cardiothoracic surgeon.
There's no reason you can't do it. It's a long, long road. You remember that picture I showed? When I was rotating back in the early 70s, I remember that I really enjoyed cardiothoracic surgery on my rotations, almost more than any. I just didn't want to go quite that far. It's a long road, but you can do it. What year are you in school?
I'm going to be a freshman next year.
In college?
No, ninth grade.
Oh, you okay? Cool. All right. So you got a ways to go, but when the time comes, stick with Jasmine. And do you want to look for shadowing experiences, including possibly with a cardiothoracic surgeon? You've got a little bit of a ways before you would do that, 2-3 years out. But in the meantime, there are things that you could be jumping on doing if it really is medicine that you want to do. Let me ask one more. Thank you, Dar. Rebecca, I can see your face. You're next to Dar. What are you going to do when you grow up?
I want to be an OBGYN.
To me, OBGYN is one of the blessed things in the world, taking care of moms when they're having their new babies. The session we're going to have tonight on virtual shadowing, if you're free at 7 o'clock, and you can go to the website and get the Zoom link, virtual shadowing. Dr. Kedia, who's one of our emergency docs, talks about falling in love while she was a young doctor, getting married and having her children, and how that affected her, her time, her ability, and so forth. So having a family while being a doc was very interesting. She's still a young physician, but you may find that interesting. But and you need to come to Parkland in a few years, because we are one of the busiest OB-GYN hospitals in the United States. How's your Spanish? Are you fluent?
Not at all.
Well, you need to work on it. In high school, you should take Spanish, because 50% of, if you stay around this joint, 50% of our patients at Parkland speak no English, of which most of it is Spanish. And so I've learned a little bit over the years, enough to say, take a deep breath, where's your pain, and all that sort of thing. Damaso, is that, I'm not sure I'm saying it wrong.
Question in the
Yeah,
chat.
Okay, what?
Why did you choose to go into medicine?
That's a good question. Everybody's different. I started at the University of Georgia in 1970 in pre-law. And after a year, my next older brother was in law school. I didn't enjoy it. And so actually I talked to my father. My oldest brother was in med school, and my father, I had always been good in sciences. And my father talked to me and he says, well, why don't you give pre-med a try and see what you think? And what then happened when in the spring of 71, when I know that seems like forever ago, but it's minutes ago in my life, it seems. I immediately found that I was very interested in the courses that I was taking. So the clue to me was the fact that I found a lot of interest in the sciences and the physics and the calculus and such things that I was taking. And so that spoke to me and told me that I looked like I was on the right path. Jasmine. What else, Jasmine? That's good. Damaso or Damaso? How do you pronounce it?
Damaso.
Huh?
Damaso.
Well, anyway, so what, you got a question?
Yeah. What was like the most stressful experience you had in the ER?
That's a great question. I've been doing it a long time. That's a great question. I've seen so many sick people over the years. Friend of my family, old guy, my parents' age, came in with epigastric discomfort. This many years ago, 35 years ago. And this just stands out because I was at home practicing medicine in my hometown, and they came to me because they knew my family, because I was the hometown boy come home practicing medicine there in the ER. And I started working him up, taking care of him, and he suddenly got much sicker in the emergency room, this friend of my family, to the point where ultimately he had a cardiac arrest, deep shock. I thought he'd ruptured an aneurysm, and we took him to the cath lab to try to save his life, and we couldn't save him. And I had to pronounce him deceased, pronounced him dead. And I had to go back to that lovely family that moments ago I was with them saying, I'm your doctor and I'm going to take care of you. And I'd lost him. And that's really, really hard. You get used to that, Damaso. I'm sorry, I don't pronounce it right. Whatever, Damaso. You get used to that. Excuse me. You get over it. But I don't think you exactly ever get used to it, because You know, what if you got really sick? You'd be scared to death, wouldn't you? Sitting in the ER, sick and hurting and all that kind of thing. Um, and as a physician, we pick up some of that pain of that patient and we help carry that pain. That's okay. That's what a good doctor. I think, Jasmine, you heard from Dr. Salazar last time, right? Didn't you? Didn't he speak to you? He's a wonderful doctor. He's a real strong advocate for the person. And so the point is that you just have to make sure you measure that a little bit, that you don't get too close. With that man who passed away, and I had to tell his family, we all sat there just in the hallway, sitting in our chairs, crying for the loss of that man. But then, you get past it, move on, but you don't ever exactly quite get over it. I probably said too much, but anyway, that's a story. Let's take one more. Is it Ta or Tha or Ta? I can see your face there. Yeah, you got a question?
Yes, it's Ta. What's my question is, what would be your favorite thing about emergency medicine?
Great question. I can get that one easy. I fairly, and this kind of gets back to, I think, Rebecca's question maybe. I fairly early on realized that I didn't want to spend a lot of time with people. When I say that, I meant years. When you're a surgeon like Dar wants to be, I believe it was, right, Dar? Once you operate on somebody, you're connected to them for the rest of your career. When you cut on somebody, they're part of your life forever, and you better do a good job. And I just decided I didn't want to be that close. And so in an emergency department, on any given day, 20 or 30 patients will come see me. They will have all ages, all genders, all languages, and all medical and trauma conditions. And so I get to go from one to the next and talk to them, do a history, do a physical exam, get the information, and then decide what's wrong and treat them, and then either put them in the hospital or I will send them home. So I like being able to have a lot of different challenges, a lot of different cases. I like that. I like thinking on my feet in a big, busy emergency room. I would like to get you all to come in and shadow when we can do that. I actually have had high school kids shadow me before. And Jasmine, you can connect with her and we can try to figure that out down the road. But in the meantime, if you want to do virtual shadowing, and Ta, we're going to tonight, this is the emergency doctor who's going to talk to us. And she's going to talk about a day in the life, including how to handle an ER with 20 sick people in there. How do you make decisions going from one to the next to the next? We're going to do that tonight. And if you want to come, you can go to virtualshadowing.com and you can watch it. It's 7:00 tonight. You're more than welcome. All right, Miss Jasmine. Yeah, peace. Okay, Miss Jasmine, that's now 12:30.
Yeah, okay. I'm gonna do like my final question because it's a question I asked Dr. Salazar. If you had a choice to do it all over again, would you do it again, and what would you do differently?
Yes, I would do emergency medicine again. Once you get out of college and if you go to medical school, you may well owe $100,000, $200,000, $300,000 in debt, unless you have a wealthy parent, and you may have a lot of money that you owe. And so the finances of this, because you have to borrow money to go to school, and the finances of this can be quite difficult. And so it's a decision you don't make without really thinking about it. Are you really going to borrow as much money as for a house to go to college and then have to pay that off? When I got into business, I'm answering the question, Jasmine. When I got into business back in the 80s, I wish I'd been a little more careful about managing money. Because young physicians, young PAs, young nurses can commonly say, boy, I went to school and I did all that. And I wish I had been a little more thoughtful about money management. I started running a business. I was running a company hiring physicians. And I wish I had been a little more thoughtful about money management. If you asked me so there it is. But I wouldn't I love this career. Let me give one last point. Does everyone have a smartphone? Hold it up. Let me see it. I can't see you, Dar. Jasmine, you got yours. Okay. What about it, Rebecca? You got a smartphone? Okay. I don't either. I have a flip phone, actually. Yes, I'm a 67-year-old man with a flip phone. And actually, I just got rid of this flip phone to get this flip phone. And I know that seems silly. But the reason I bring this up is this. You have in your phone or in your computers every fact in the known universe. You do. Every fact in the world, in the universe, is available to you. And so if you're going to go into medicine and you find something that you don't know, folks, look it up. And I will challenge you. I will do it too, because I do that. It's not about me. I'm not saying I to be anything immodest. I'm just saying, if you need to know something, look it up. And the good news is that we're surrounded by computers today, so it's really easy to look it up. My challenge to you, Jasmine, with closing, if you come across something that you need to know, look it up then, or mark it to where you look it up very quickly so that you can study it and continue to improve your mind with the passing years. Jasmine, it's been an absolute pleasure. Please ask me again. And you kids, kid is a compliment at my age, are more than welcome to down the road communicate through Jasmine. And if you want to try to look at some shadowing experiences, we can do that.